Hello, I'm Anna Abella.
And I'm Amy Vargo.
And we would like to share with you a little about a study we're doing to understand grantees' perspectives on STOP program implementation.
Our research team is made up of faculty and staff at the University of South Florida in Tampa who have experience in program implementation, children's mental health services, and education. We've been awarded a grant through the National Institute of Justice, or NIJ, to study the implementation of 2018 and 2019 STOP program grantees who were awarded funding from the Violence Prevention and Mental Health Training category.
These are the research questions we would like to answer with the study. How have diverse stakeholders been involved in stages of implementation? And this may include school administrators, school-based community health professionals, teachers, students, and families, school resource officers, and policymakers. Next, how has identification of violence prevention and mental health training programs been representative of community needs? What are the perceived barriers and facilitators to implementing violence prevention and mental health training programs across grantee sites? How do various components of the implementation process contribute to satisfaction with implementation at different stages among stakeholders? And what measures are in place to evaluate and inform continuous implementation processes? And where do opportunities and needs exist for incorporating feedback to strengthen overall implementation?
To answer these questions, we designed a research study with two different components, an electronic survey and a case study. We will be asking all grantees to complete the electronic survey, and then a much smaller number of grantees to take part in the case study.
First, for the 128 grantee sites who received Bureau of Justice Administration funding for STOP programming, we will disseminate an electronic survey to grant administrators or relevant site contacts who have been involved in implementing programs or training from STOP funding. Questions in the survey will ask about implementation factors, barriers, and facilitators to implementation, the capacity of schools at each site to address mental health, satisfaction of the implementation process, and how COVID-19 has impacted the implementation of STOP programs. There will also be an opportunity to share open feedback. This survey will be administered once in July 2021 and once in 2022, and we anticipate it taking around 20 minutes to complete. Each participant will receive a $10 electronic gift card as compensation for their time.
The second part of the study is a case study, and it will be more in depth than the survey. We will select 10 sites from the 2018 and 2019 grantees who will work with to gather more information about their efforts to implement STOP programs. This may include gathering documents such as the STOP grant proposal, relevant policies and procedures, MOUs with providers, or training materials. We may also occasionally observe relevant planning or programming meetings to better understand barriers and facilitators of implementation. And as a part of each case study, we'll be interviewing approximately 6 staff per site to gain insights on experiences with implementation and what social, political, and cultural factors have affected implementation. Sites who are selected will receive a $200 incentive to help offset the burden of coordinating activities. We also wanted to stress that participation in this study, both the survey and case study, is voluntary. However, we hope to receive as many responses as possible so we can help inform ongoing efforts to implement violence prevention and mental health training programs, and potentially help address challenges that sites are facing.
This study will be part of a feedback loop that will be used to improve programs and training. After initial data collection, we will share findings with the NIJ and grantee communities through reports and webinars, which may be used to inform ongoing implementation efforts. This process will continue within the 2-year study period.
If you have any questions about this study, please feel free to reach out to us using the following contact information. Thank you very much for your time, and we look forward to working with you in the coming months.